All right, everybody. This is one of the best times of the whole conference, I always find, because it's a time for us to honor our colleagues in a way that we don't have many opportunities to do so. So before we get into the program that is online, there are two people who have been with CUGH longer than anybody else. Longer, in fact, than the day we opened up our offices in Washington in September 2012. These two individuals have been not instrumental, but fundamental to the conferences we put on every year. They don't just do their job, but I can tell you they have absolutely had our backs at every single turn and have gone over and beyond the call of duty every single time we've had a conference to make sure we have the best conference possible. So this wasn't just a work between colleagues. This was an endeavor with family. So I'd like to call to the stage Norm Stein and Doris Steinbach. Nancy, please. So, I hope this came in. Good to see you.
Thank you. Oh, sure.
Nancy, you want to come up?
Oh, sure.
There you go.
Picture.
Right over here. We got to go over here.
Oh.
Yeah,
With the flowers or what?
on the other side.
On the other side. I don't have a run of the show.
Oh, there you go.
So I don't know what I'm doing.
We're standing on this side, yeah. So we have a little bit of space.
I should have found it.
Thank you. All right. We had to do all kinds of things to make sure that no one knew, they didn't know about this. So we had great conspiracy with their great team who were over there, Naomi, Alex, and the team. Who've also been with us for a few years. The other individual I just want to we want to particularly honor today is an individual who is retiring. He has been people like to bash the public service, but if you look at this individual's history, he exemplifies the best of the public service. People who are extraordinarily skilled and brilliant, but have chosen to use their skills and brilliance and passion and heart to improve the well-being of people around the planet. So throughout his career, he has done so. He is the acting director of the Fogarty International Center, the acting associate director for international research at the U.S. Institutes for National Health. He has held multiple leadership roles at Fogarty, at the CDC, and at others. And as I mentioned, he has spent his whole life saving lives. So with that, on behalf of CUGH, Dr. Peter Kilmarks, we would like to honor you. In the front. Oh, Peter, you got to have this.
Thank you.
Great. I'll get in the front.
Thank you.
Thanks.
Thank you.
And with that, I'd like to call up Zoe Mullen, the editor of the Lancet Global Health, and Dr. Nancy Reynolds, our chair.
Hi everyone. It gives me great pleasure to announce, well, the second most important awards of the evening. Usually it's the most important, the Student Poster Awards. There were a few sneaked in earlier this year, and well-deserved they were. I'm going to call the winners to the stage one by one to collect their certificates. And if you could all just remain on the stage with us, we'll have a photograph all together at the end. So, without further ado, the first award goes to Ali Zaidi from the University of Colorado Anschutz School of Medicine. And the second awardee is Yvette Nkunguriza. Sorry for the pronunciation. The next winner is Francis Afusu Koranteng from York University in Canada and the University of Ghana. Our next winner is Maria Barra from Rice University in the US. It's a long way up there. Congratulations. Thank you. Our next winner is Teresa Norpeli Yanyo from University of Michigan. The next winner, which I think is a joint prize, is Sarah Feinberg from Tufts University Move Up Global, and Garwon Yu from Tufts University Move Up Global. And our final winner in the student poster competition is Ahila Orulmani from Touro University, California College of Osteopathic Medicine. Okay.
Good afternoon. It's now my great pleasure to introduce the winners of the CUGH 2026 Distinguished Leadership Award. And we actually have two co-awardees this year. In alphabetical order, the first is Dr. Robert Lee Murphy. He's an internationally recognized infectious disease physician, educator, and global health leader. He is the John Philip Farr Professor of Infectious Diseases at Northwestern University Feinberg School of Medicine, where he serves as Division Chief of Infectious Diseases and Executive Director of the Institute for Global Health and the Center for Global Communicable Diseases. For more than 4 decades, he has combined academic leadership, clinical expertise, and global engagement to confront infectious threats and strengthen health systems worldwide. He has trained generations of physicians and public health professionals while advancing collaborative partnerships across Africa, Asia, and Latin America. Dr. Murphy has been central to responses to HIV/AIDS, Ebola, COVID-19, and other global epidemics. Under his leadership, Northwestern's Institute for Global Health has become a multidisciplinary platform that integrates research, training, and implementation to address urgent communicable disease challenges. So congratulations and wonderful achievement. Yeah. Oh, yeah, yeah, well, yeah, you can go ahead. Yeah. Whoops.
Nancy, you get the picture first. There you go. Great. It's yours, and then we'll take a photo now, and then you can take a speech. Go ahead.
Go here, okay. Now talk? Well, thank you very much. And just in the nick of time, as I'm retiring next year. I want to thank you all. Thank you, CUGH, for this award. Perfect timing, thank you. I want to thank my colleagues at Northwestern University who have been so supportive, and it's an incredible, incredible team. I want to thank all of you for being here and listening to me. I want to tell you, this is really a huge honor because I really, really do love my job, and I love my career. I have been really completely fulfilled working in global health, which started in 1993 with the U.S. Peace Corps, not as a volunteer, but as an assignee from the Department of State to go figure out figure out a problem there that they were having with Peace Corps volunteers coming back with HIV. And that started my whole global health interest and career. From then on, the hard achievements and things that I really enjoyed working on were the PEPFAR program, Track 1 PEPFAR in Nigeria. I was the country director that ended up setting up 55 sites and treating 150,000 people. I'm very proud of that. The 10 research training grants I had from the Fogarty International Center that have trained so many people that are even in the audience today. The POCTRIN program, Point of Care Technologies Research Network from NIBIB, working on developing new diagnostics in Africa for HIV and emerging infectious diseases. And I really thank the people at Northwestern, my leadership there. What started as a research program in global health when I was first working in PEPFAR, which was actually the second drawer on the left side of my desk, that evolved into the Center for Global Health for 10 years, and then under Dean Nielsen became the Institute for Global Health, which has 10 centers. Many of you actually are in the audience, and I can't thank you. It's been a tremendous opportunity to work with so many wonderful people. All that is great, but you know, when my time comes on my tombstone, I don't want it to say I had 378 peer-reviewed papers. I really want it to say, I'd rather have more people at my wake. You know, I'm Irish, so we always talk about this. But I've mentored so many people on these research training grants through PEPFAR, through all the other programs. It's been really a joyous occasion. When I walked into this meeting, first I bumped into Keith Martin, but right after Keith Martin, I met Sumela Traore. I don't know if he's in here. He's one of my trainees. Oh, there he is, right there. So I supported his PhD, which he's finishing up in June at Cheikh Anta Diop University in Dakar, Senegal. And it was just so great to see everybody after really all these years. I want to thank all my collaborators at the NIH, at Fogarty, NIAID, and NIBIB in particular, at Northwestern, as I mentioned, all the networks where I've met so many wonderful people, the ACTG, the MEPI program, the POCTRIN program, and all the global collaborations I've had. What I'm actually most proud of is the fact that 2 of my mentees named their kids after me. So in Mali, there's a Mohamed Robert, it's French speaking, Mohamed Robert Mega. And in Nigeria, but they moved to Chicago recently, there's Jeremy Robert Musa. So I have little godchildren out there. I have 2 girls of my own, but it's just great. And then some advice maybe to get to this position yourself. Enjoy your passion, work hard, adapt when necessary, learn how to communicate. It's a little bit harder than you think, but you must communicate not only with your peers, but with the community that you're serving. It's more important than anybody thinks. And finally, my last comment, I know I'm right at the end of my 5 minutes, is the Explore Global Health podcast. It's one of the reasons probably why I'm up here. I've been interviewing leaders in the global health field, including 6 people at this meeting in the last couple of days, including Keith Martin, Dr. Barnoya from Guatemala, Solange Baptiste from South Africa, Stephen Volz, former NASA physicist, Dr. Robin and Hudspeth from Yale and BU, particularly who are on the CUGH Working Group for Equitable Opportunities in Global Education, and Dr. Barbosa da Silva, who's the head of PAHO, who was just on the last panel, along with Dr. Barnova. It's been wonderful meeting all of them, doing these podcasts, and I'll continue to do that for a while. And I encourage you to, if you want to listen to these people, they're just wonderful. They have great stories. And I, again, just want to thank everybody for giving me this award. I really appreciate it.
Congratulations, Rob. And do look at his podcast. Rob does a phenomenal job on it. Most of us, or many of us, are in medicine in the global health space, and at CUGH we've been working really hard to get other disciplines involved. So it's a particular pleasure to announce this next awardee of our signature award, who is the first veterinarian ever to win this award. Indeed, and very well deserved, as you'll find out. So Dr. Vartrina Smith has dedicated her career to rapidly and practically advancing global health equity by fostering intensive partnerships with more than 100 universities in 17 low-income countries. She's a professor, this is somebody who's obviously low-skilled, professor of infectious diseases, agronomist, epidemiologist. Dr. Smith is also the executive director of the UC Davis's, University of California Davis's One Health Institute, one of the premier veterinary schools in the world. And she's done a wonderful job bringing together industry, academia, environmental organizations to identify solutions to some of the world's most complex and difficult problems using a One Health approach. Dr. Smith has developed a global One Health Academy, so you can take a look at that online. And she has truly inspired thousands of learners, mentored so many, countless numbers of students, and has worked across disciplines to address the triple environmental crisis of climate, biodiversity, and pollution. And with that, I'd like to, it's our great pleasure at CUGH, Dr. Smith, to award you our signature Global Health Distinguished Leadership Award. Well done. Well done.
Well, thank you to everybody. It certainly is a wonderful honor to be recognized. I think this is a tribute, not so much for me, but for the wonderful teams that I've been honored to work with over the past 20 plus years while we've been doing global health. And I never thought I would do global health. I was going to go be a vet and all sorts of little stuff. And then the comparative medicine approach really showed me how all of us can be doing more together than we can on our own. So this idea of One Health, connecting animals, humans, and our shared environment was powerful. Even now, I think we can all agree we are a globally connected society, and we really are stronger together. So the past year has been a bit of a shock as we pulled back from a lot of programs and promises with our partners around the world. And often we think about, what should we work on for the next 5 to 10 years? But maybe it's also nice to think about where we've come in the past 5 to 10 years. So if I think about 2016, 10 years ago, you can think, what were you doing 10 years ago? For me, I was having a wonderful time because I was part of teams that were doing One Health surveillance. So working with veterinarians, with biologists, with physicians, with nurses. How do we do surveillance for potentially pandemic viruses in 30 different countries across Africa, Southeast Asia, and Latin America? and training those teams, learning from each other as we went along in the field work and the clinic work and the lab work, risk communication, that full spectrum of activities was really inspirational because it wasn't any one of us teaching everybody. It was really figuring out what works, what doesn't, tailoring that to the local community settings, because really everything we do starts and ends with communities, right? So how to do that better? In that 10-year large USAID project, we did One Health surveillance and trained over 6,000 people in the various countries we were working in. And they were some of the first responders in the pandemic to really understand for COVID-19 what the heck was going on. We'd already discovered over 1,000 new viruses. Many of those were coronaviruses. So I hope that the work that we'd done in that decade really helped us to figure out what was going on with COVID-19 a little bit faster. And it was really wonderful to see some of the folks that we trained be the ones to solve those problems in Southeast Asia and then in the US to understand how do those patterns work and how do we really have those weekly calls to say, you know, what's the new development? How can we do this even better? If I think 5 years ago, that was 2021, we were just starting to come out of the pandemic. I was leading a different USAID project, working with 15 countries across Africa and Southeast Asia. And that was really a global training grant. So we were able to pilot new training innovations. We were also able to work with the Africa One Health University Network and the Southeast Asia One Health University Network. So over 100 groups coming together and saying, we like this transdisciplinary, collaborative approach to problem solving. We might not have all the answers, but we're gonna figure it out better by working together. And that trained over 60,000 people. In person, online, during the pandemic. It was really proof of concept that those university networks can be resilient, can come up with new ideas to be able to solve the emerging problems of our time. So I'm glad to see that even though a year ago we had to pull back from some of those large programs, those networks still exist. They are finding new ways to innovate. I hope that we'll be able to partner again. And I think, you know, today I'm feeling a little more hopeful than I was perhaps a year ago at this conference, because we're seeing that we're going to try and ride this out and that we should take nothing for granted. And all the things that are really our core values, we have to stand up for them individually, not just assume someone else is going to take care of it. And so I hope going forward that all of us will be able to keep doing that. That's why you're here, right? So being able to keep leaning in and working together collaboratively, globally, to be able to make positive change, I think that's a big responsibility, but also an honor that I hope all of us can work on together. So thanks very much for this award. It means a tremendous amount, and I really appreciate it.
Ask Dr. Nelson Siwan Combor, the president of the African Forum for Research and Education, to present the next award.
Ladies and gentlemen, I'll present to you two co-awardees. The first one is Dr. Christine Garulia. Let me tell you a little bit about Christine. She is an associate professor of emergency medicine at Stanford University and director of the Stanford Emergency Medicine International Global and Populational Health Section, where she leads a team to advance equitable emergency and NCD care globally. She is the PI and director of the NCD Rights Lab and has contributed to national and international NCD policy efforts. She has worked with NIH and the WHO to shape the global implementation science research agenda for NCDs. Previously, at Yale University, she served as director of global health research and co-founded the Yale Network for Global Non-Communicable Diseases. She has held leadership roles with CUGH, currently Research Committee co-chair, as well as the Society for Academic Emergency Medicine, the African Federation for Emergency Medicine, and the Women Lift Health. She is the Global NCD Section Editor for PLOS, Global Public Health, and an active public voice on global NCD equity. We congratulate you. Please. Oh. Can you help with this? Of course.
Nelson.
I don't need it.
Okay. Good.
The second co-awardee is Dr. Magari Blas. I hope I pronounced that correctly. So, Dr. Blas is a physician, public health researcher, and visionary leader dedicated to improving women's and children's health in remote and underserved communities of the Peruvian Amazon and border regions. She's an associate professor at Universidad Peruana and the affiliate associate professor at the University of Washington. Dr. Blas is the founder and director of Memoir del Rio and Mamas de la Frontera, community-based programs that empower women and train community health workers to prevent maternal and child deaths. These initiatives have reached thousands of families across Peru and Colombia, bridging healthcare access gaps through intercultural approaches, digital innovation, and political advocacy. She serves as head of the Political Advocacy Secretariat of the Peruvian Medical Association, where she advocates national health reforms, and as director of the Intercultural and Indigenous Citizenship Unit at her School of Public Health. She has published extensively, mentored future global health leaders, and influenced policies to promote equity in marginalized populations. Congratulations. Sorry.
It's now my pleasure to announce the awards for the CUGH 2026 Dr. Judy Wasserheit Young Leader Award. Two more very talented people to honor here. The first, unfortunately, can't be with us. Her name is Dr. Aisha Ali, is a resident at Central Park Medical College, University of Health Sciences, Pakistan. She currently serves as a Commonwealth representative on the WHO Youth Council, where she contributes to global dialogues on universal health coverage, health workforce policy, and planetary health. As coordinator of the Commonwealth Youth Health Network at the Commonwealth Secretariat, she has co-authored multiple policy and technical reports, represented the Commonwealth at the 78th World Health Assembly, and delivered the official youth statement of the Commonwealth Health Ministers Meeting in 2025. Ayesha also represents Pakistan as the lead convener for the UNICEF South Asian Young People's Action Team and the Youth Health Lead for the Commonwealth Leadership Institute, where she advances youth-led policy advocacy on health workforce readiness and community health systems. So please join me in recognizing her. And our second terrific awardee is Dr. Hannah Stewart. She's a fifth-year PhD student at UT Health Houston School of Public Health and the Chief Research and Knowledge Officer at the Generation Mental Health. She recently received the 2025 Youth Professional Award from APHA's International Health Section. Hannah leads the Possibilities Collective, commissioned by the Wellcome Trust, creating capacity-building ecosystems, positioning young people and those with psychosocial disabilities as change makers in global mental health research. With 20-plus peer-reviewed publications, her research focuses on mental health and substance use recovery housing, health equity, and lived experience engagement. Hannah holds the Augrant Norma Pauling Fellowship in Social and Behavioral Science from the University of Texas System. She centers the rights and experiences of marginalized communities, particularly in mental health and substance use contexts, honoring the legacy of civil rights advocates who opened doors for people like her. So, congratulations. Whoops.
So now Georgina Yaboa and I are going to bestow the James G. Hakeem Award. The late Dr. James Hakeem was an acclaimed researcher and professor and a profoundly important leader in advancing medical research and education in Africa. He was the chair of the Department of Medicine at the University of Zimbabwe, a founding member of AfriHealth, a member and esteemed partner to CUGH, and a longstanding prominent grantee of the Fogarty International Center, and a dear friend, colleague, and mentor to many of us here today. His memory is memorialized through this annual award supported by AfriHealth, CUGH, and Fogarty. Each year, the James G. Hakeem Award provides an African early career health professional with funding to cover registration and travel to the annual CUGH meeting. To be eligible, they must be a citizen of an African country with a primary professional affiliation with an Africa-based institution and enrolled in a degree-granting educational program from an accredited African university or no more than 5 years from receiving a terminal degree. The main selection criterion is having the highest score on an abstract admitted for the CUGH annual meeting.
Ladies and gentlemen, this year's awardee is Ms. Ineza Elvira. She is a medical student at the University of Global Health Equity School of Medicine in Rwanda. Her abstract is entitled Unlocking Rural Potential, the Transformative Effect of the Butaro Scholars Program. The Butaro Scholars Program is a student-led initiative by the University of Global Health Equity that supports local school children in Butaro, Rwanda, by improving their English, computer skills, and academic development to expand their future educational opportunities. Ineza is presenting this work as a poster presentation yesterday and today. and I encourage you to go and see her poster this afternoon. Congratulations, Ineza, on your award, and to your colleagues on this remarkable initiative. Dr. James Hakim would be very proud of your contributions to your community.
We'll also get Nelson up too. Sorry? Sorry? You both. Yeah. Sorry. That's okay. There you go. Yeah. And as was mentioned before, please take a look at all of the award-winning posters have been for the last 2 days, and you can see them downstairs, so please do so. Next, I'd like to call one of the founders of CUGH, Dr. Anwar Belgi. He and his wife Pari have been outstanding supporters of CUGH since the beginning, and through his generosity, we are able collectively to honor some remarkable people. With that, I'd like to ask Dr. Belgi to please come to the stage.
Thank you very much for attending this wonderful conference. It takes a lot of time and effort on everybody's part, and you heard this before. And every year, I'd like to be sure to thank everybody who worked very hard. And I'd like to start with some of the staff in the offices, because they have to go through a lot of paperwork, selection, etc., and all the correspondence that they have to do. Norma Verona, Elizabeth Huroni, Ian Evasco, and Sarah Kellogg. But above all, I also would like to thank Dr. Keith Martin for almost 14 years of tremendous service. He is a parliamentarian and is a diplomat at the right time for us at CUGH. So today we'll present the first award to Student Leader in Global Health, Mustafa Rafat, a PhD candidate in social work at Washington University in St. Louis, where he has transformed his lived experience as a refugee with disabilities into globally relevant innovation that bridges clinical practice, social policy, and human rights. Mustafa leads a multi-state research and advocacy initiative examining the social determinants of health among refugees with disabilities in the United States. He developed an evidence-based language access plan that has been shared with community clinics, disability agencies, and refugees resettlement programs. His program treats communications as a determinant of health and reframes language justice as a core component of global health equity. As a founder member of the Refugee Empowerment Task Force at the American Congress of Rehabilitation Medicine and a board member of the APHA Disability Justice Advisory Board, he advances disability inclusive policy across national networks. He teaches English to newly arrived refugees who cannot attend class in person, serves as a community liaison for the International Institute of St. Louis, and mentors students entering global health fields. It is our great pleasure to present him with the Student Leader in Global Health Award. Thank you.
You go in the front?
Can you join us? Join us. I want you to join us here too.
Yes, yes, you go in the front.
Okay. Congratulations, Mustafa. Our next award goes to the Faculty Leader in Global Health Innovation. Dr. Joanne Marlene Bewa is a faculty and assistant scientist at the Johns Hopkins Bloomberg School of Public Health Center for Global Digital Health Innovation, where she co-leads a $2.2 million research portfolio of telemedicine evaluations, which reaches all the way across to Indonesia, and leads an evidence synthesis project of over 12,000 studies on digital health interventions, oversees the Gavi-funded M4H initiative in DRC, and telehealth for contraception care in the Benin Republic. Dr. Bewa has designated, implemented, and scaled a context-appropriate telehealth innovation in West Africa that bridges gaps in primary, reproductive, and maternal care. She led the development and deployment of DOTOH, which is Benin's first inclusive telehealth platform, just in case you go that way. She builds capacity, trains young investors and innovators. I put that investor part in it. We need the money. Advises ministries and collaboration with implementing partners, so the solution is locally owned and sustainable. Her work has informed local policy discussions and has been used by partners to prioritize outreach to service deserts. It is our honor today to present you with the Faculty Leader in Global Health Innovative Award.
Well done.
Thank you.
All set? Thank you. It's our pleasure. Our next awardee is that for teaching excellence in global health. The awardee this year is Dr. Shahnaz Chowdhury, who is a professor and head of Department of Community Medicine at the Bangladesh University of Health Sciences. She holds adjunct faculty positions at Bangladesh University of Professional and International Standards. Dr. Chowdhury is a leader in global health education and goes beyond conventional teaching methods to empower students, advance equity, and spur systemic change. She developed a cutting-edge outline postgraduate certificate course in global health. This is the first organized and accredited online global health program created and offered from Bangladesh. It has been specifically designed to assist participants from LMICs who frequently face obstacles to accessing advanced global health education. She co-chaired CUGH's Global Health Competencies Subcommittee and contributed to the development of CUGH's Global Health Competencies Toolkit. It is our pleasure today, Dr. Chowdhury, to present you with the Teaching Excellence Award. Thank you. Thank you.
Great job. Well done, Sinead. Good job.
Our next awardee is Dr. Comfort Peace Ayakoru, who is a population health scientist and medical doctor committed to advancing evidence-based interventions and equitable health systems that improve outcomes for mothers and children. She co-founded Buri Care Limited, a Ugandan social enterprise transforming neonatal survival through sustainable, locally made innovation. She developed an eco-friendly, sensor-integrated neonatal wrap that brings NICU-level insights to mothers miles away, offering a safety net where none existed before. She also works with the Infectious Disease Institute in Uganda, where Nelson is the big chief, and Academy of Health Innovation and Impact, advancing led health innovation. Her leadership has earned international recognition from Forbes Africa 30 Under 30 Healthcare, Commonwealth Youth Awards, and the African Women in Development Award, among others. And today we have the pleasure of presenting the Young African Leader Award to Dr. Comfort Peace Ayuku. Unfortunately, she could not be here with us, but we wish her all the most success and congratulations to all their families. And our last award is Planetary Health, One Health Innovation Award. And today it's our great pleasure to present this award to Dr. Carlos F. Aron Guzman, in a global health professional with a deep-rooted passion for education and a commitment to promoting health equity, addressing complexity and emphasizing the importance of values in shaping a better world. As an educator, Dr. Ferron fosters an environment of collaborative learning and knowledge exchange that empowers communities and individuals. Dr. Ferron serves as Associate Professor of Global Health at the University of Maryland, Baltimore Graduate School. He is a Senior Advisor of the Planetary Health Alliance at Johns Hopkins University and Director of the Inter-American Center for Global Health in Costa Rica. He began his career as a primary care doctor in a rural area of Costa Rica, where he worked closely with migrant and indigenous populations. He is a global health leader and now a planetary health leader as well, advancing intersectoral transdisciplinary solutions that will improve the health of people and the sustainability of the planet. It's our pleasure today to present this award to Dr. Carlos A. Herreras Guzman.
Thanks so much. Fantastic.
You want me to show that
You
last
show,
slide?
you should go show the talk.
Can they see it all over? Oh, everybody can see that slide? It was taken in Costa Rica. He didn't know about it, but we're following his trail as he grows up and replaces all the giants beforehand. He's going to be a giant as well. This award was being presented to an eminent Secretary of Health in 1998. And here you see the picture appearing, unknown to us, in the paper next day. Part of the importance was also the presence of the past president of Costa Rica, who was a Nobel laureate. And so I thought it would be nice for a Costa Rica presentation here to show we are expanding into Latin America as well, to be at one with all the populations. Thank you so much.
Thank you very much, Dr. Valci, and we really are immensely grateful for you and PARI's ongoing support of these awards. The next award was, we were honoring the 2026 Global Health Video Competitions. This competition is our effort to try to encourage people to tell important stories about innovations and challenges that are happening so we can show these visuals to people around the world. And the winners of this award, unfortunately, neither of them are going to be able to be here in person, but we do have one person who will be receiving it on their behalf. The first awardee is to Olivier Hangenemanana and Dr. Laura Ndalaga from the University of Global Health Equity in Rwanda, and Dr. Pierrette Nguret Nkongwandwa will be the person who will be accepting that on their behalf. One moment, stay here, please. It helps to have the certificate. One for you. Yes, these two. There you go. You can stand in the front of the picture. Nancy, Drew. Next, I'd like to call Dr. Brian Simpson and Dana Myers to the podium, please. Stay. No, come here. Stay here, thanks. The other person who won this award, who is not attending, is Dr. Tasdik Hassan. His award for the video competition was for surgical training in global health. Tasdik is from Monash University in Australia, and his video competition was In the Silence We Found Hope. So we are really honored to honor Dr. Hassan at this moment. Unfortunately, he could not be here, and we will send him his award. So thank you.
And I'm delighted to be able to present the Untold Stories in Global Health Contest Award winners, the two grand prize winners. First, I would just like to say thank you to Keith Martin and CUGH for co-sponsoring this contest with Global Health Now again this year. And we look forward to seeing the great stories that come out of this year's winners. So the first grand prize winner was not able to attend, but please join me in congratulating Audrey Claire Benson from the Barcelona Institute for Global Health in Spain. And her nominee, the idea that she entered, is Unaccompanied Moroccan Boys in Ceuta, Spain. And the next grand prize winner, I believe, is here, Dr. Jackie Odiambo. Ah, yes. All right. So she's with the University of California Global Health Institute, USA, and the Nia Nam Widows Rising in Kenya. And the idea that she entered in the Untold Stories contest is health disparities in widowhood. So, congratulations. All right, and Toby.
Thank you, Dana. Thank you. And I do encourage you to take a look at Global Health now. It's online. And Dana and Brian, they work tirelessly on this. And Dana really does an incredible amount of work on this award. And I just really, on behalf of all of us at CUGH, Dana, thank you so much for all of your hard work. It's a big lift, but you're getting those untold stories out there, so we're grateful. And to Brian for his ongoing support and effort, thank you very much. The next award, I'd like to call Carolina Palmieri up to present the next award, please.
Thank you so much, Keith, and good afternoon, everybody. On behalf of Child Family Health International, it's such a pleasure to present this to winners of the Multimedia Reflections Global Health Contest. So we have two really good and exciting people to award today. First, I want to call Eukaria Aluchi Nwachi with the essay, When the Ground Speaks, Lessons in Humility from the Niger Delta. Congrats. And the second one I'm going to call is Baralai Khan with the essay, Three Systems, One Patient.
Well done. And I'd just like to honor Dr. Jessica Evert there. And Dr. Thuy Bui. Is Thuy here too? Thuy? So Jess and Thuy have really been the originators of the reflections. They developed a book because this competition has been going on for more than 10 years. So I'd encourage you to take a look at the book. It's a beautiful rendition of reflections from students over a decade. And they're incredibly poignant and powerful. So Jess, thanks so much to you and Thuy. Amazing work. With that, I'd like to just thank Elizabeth Hourani, who did an amazing job putting this together with Norma. She's back there working tirelessly. We'd be somewhere else if we didn't do this. And thank you to all of the presenters, and a particular congratulations to all of the awardees. You inspire us. And make sure you go to the Pulitzer Film Festival at 6:30 tonight. You're going to have two amazing films that are powerful, that speak to the moment, and the producers are going to be there. And I think we're going to have a PBS journalist there too who's involved. So it's a lot of fun. See you tonight.